I'm Michelle Nelson. I'm the Director of Population Health Management for the Henry Ford Medical Group, which is part of the Henry Ford Health System in Detroit, Michigan.
My name is Bruce Muma. I'm the Chief Medical Officer for the Henry Ford Physician Network. This is a large commercial ACO within the Henry Ford Health System in Southeast Michigan. I also have a second role as the Medical Director for Population Health Management for the Henry Ford Medical Group, which is a large employed group practice also within the Henry Ford Health System.
We have access to a lot of data, mostly through paid claims, or all through paid claims from our payers. That information is very valuable, but sometimes it can be very overwhelming. You have all this data and you can't identify specific areas that are actionable and manageable. So using MedInsight, the CCHGs, it makes that process much easier to identify that population that you can develop initiatives that are manageable and actionable.
The MedInsight tool for us really provides that credible, reliable, and relatively easy to use window through which to view the data for the primary purpose of changing the way we provide care to patients. And it's about inspiring physicians to behave differently.
So one of the initiatives that we identified was the high use of very expensive drugs. So with that information, we were able to drill down to even the patient level detail of those patients on those high cost drugs. We scheduled meetings with the division head of oncology and his administrator and provided them this information, got down to the patient level detail, allowed them to do chart reviews to identify maybe alternative drug therapies for some of these patients. We also identified a high ED utilization for these patients.
We were probably the highest in the entire state of Michigan. And so we needed to understand in a fairly rapid fashion, why were our ER utilization so high? What were the underlying causes? And so we were able to use the MedInsight tool to take a deeper dive in terms of understanding our population, understanding the specific patterns of use within the emergency room. When we did take a look at that data, we discovered something a bit surprising, and that was that within the segment of patients who went to the ER more than 3 times a year, there was a subset of patients, particularly women between the age of 16 and 40, who were using the ER at a rate higher than any other subgroup. So with the Millman tool, we were able to take a deep dive and try to understand how they were using the ER, why they were using the ER. And this, of course, informed some interventions, which included building triage protocols for our Nurse on Call program, as well as meeting with the Women's Health team, leadership team, to try to design better ways of educating their patients so that they wouldn't have to go to the emergency room for a lot of things that they could get through their regular physician visit.
Through this initiative, we did see a decrease of 10% of our total cost PMPM for this population. We saw an 18% decrease in ED utilization and a 39% decrease in inpatient admissions. So MedInsight is a very valuable tool. We have found that it just gives us a vast amount of information. It has drill down capabilities. You can slice and dice data in many different ways, identify populations of patients, identify overutilization in specific service lines or the HCGs. But the CCHGs are very, very powerful to get your physicians engaged because it is based on diagnosis information. It allows you to open conversation with those physicians on specific conditions that they're caring for.